Hello friends, I am Dr. SACHIN MUTHA. Today let us study the classification of anticholinergic drugs. First of all, let us revise. For the cholinergic drug, we have made the mnemonic, that was PCM, P for parasympathomimetic and CM for cholinergic. But for the anticholinergic drug, the mnemonic it is MAP, that is muscarinic antagonist, A for atropine and P for parasympatholytic. Try to remember the difference. In the cholinergic drug it is parasympathomimetic and in anticholinergic drug it is parasympatholytic. Now let us study the classification of the anticholinergic drug. For the classification of it, it is made into three types, that is natural alkaloid, semi-synthetic and the synthetic. For the natural alkaloid, I have made one mnemonic. As the natural products are at a high demand, so the mnemonic it is at high scope, at for atropine, high for hyoscine and scope for scopolamine. Then it comes your semi-synthetic. For the semi-synthetic, I have made again one mnemonic, that is HATI, HHATI. For H it is hyoscine butyl bromide, for the second H it is homatropine, then for the A it is atropine methonitrate, for HHAT T it is tritropium bromide and for I it is ipratropium bromide. Then it comes your synthetic. For the synthetic compound, as it is little bit confusing, so I have made one mnemonic by keeping in mind one scene. The scene it is, my dad's very close auntie took us to the park, then she took us to a secret quarter and to the theatre. The mnemonic it is my dad, very close, auntie park, secret quarter and theatre. For the my dad it is mediatic and the examples are cyclopentolate and your tropicamide. Then my dad, very close it is for the vesicoselective. It acts mainly on the bladder. So how the bladder should be? It should be soft. So the mnemonic it is SOFT. For S it is solifenacin, then for O it is oxybutynine, then for F it is flavoxate and for T it is tolterodine. Then it comes your my dad, very close, antipark. For the antipark, that is the anti-Parkinsonism drug, and there the example are your triaxiphenidil, then biperidine and procyclidine. We have already studied the anti-Parkinsonism drug, and by taking the mnemonic or memorizing a mnemonic, that it was Dodo Good Komat Pani. For the anti-Parkinsonism drug, the classification in that we studied that it was dopamine precursor, dopamine agonist, then it was your glutamate NMD agonist, then it was COMT inhibitor, then it was MOB inhibitor, and it was the peripheral decarboxylase inhibitor. This was for the dopaminergic drugs which are acting for the anti-Parkinsonism classification. And the second type, there only we have seen the drugs which are acting on the cholinergic system, and there we studied two types, that is the drugs acting on the central anticholinergic drugs and the antihistaminic drug. And there it was this anti-Parkinsonism drug which we are studying here also and there also. So try to correlate, so it will be better to write in the exam and you will not be confused. Then for the my dad, very close, antipark took us to the secret quarter. For the secret it is anti-secretory drugs or your antispasmodic drug, and there it is divided into two types again, that is your quaternary compound and the tertiary amine. Try to remember for the quaternary compound and tertiary amine. Now for the quaternary compound, again I have made one mnemonic, that is gossip. G for your glycopyrrolate, then O for oxyphenonium, then your GOC for C it is cimetidine, then for again C it is clidinium, and then it is GOCCI. I it is your isopropamide, and for P it is your propanthyline. Then it comes your tertiary amine. For the tertiary amine, again I have made one mnemonic, that is Diwali-P. For D it is dicyclomine, for Wali that is your valentamine, and for Diwali-P it is your pyrazapine. Then this is the classification of the anticholinergic drug. Now let us study the uses of the anticholinergic drug. For the uses, I have made one mnemonic, that is whenever a person passes the MPSC exam, he is a very big personality. So the mnemonic it is MPSC VBP. For M, it is of course the mediatric drug, and there it is used mostly for the refraction testing. Then for MP, P it is for the pre-anesthetic drug. Try to memorize. For the cholinergic drug, we have mentioned the use, that it was for post-operative urinary retention or the palliatic ileus, and here it is used as a pre-anesthetic medication. So MPS, S it is for sialorrhea. for the decrease of the salivation. Then MPS for C, for your C, it is COPD, MPSC. V is a vagolytic, that is the example which is atropine drug. Then MPSC V, B it is for bronchial asthma, and P for it is your Parkinsonism treatment. This is all the uses of the anticholinergic drug. Now let us study some of the side effect. For the cholinergic drug, we have memorized the side effect by the mnemonic, that was dumbbell, and here it is the opposite of all the dumbbells. There it was diarrhea, here it is constipation. There it was urination, here it is urinary retention. There it was your DUM, M for miosis, here it is a mydriasis. Then DUM B it was bronchospasm, here it is decreased heart rate. Then DUM B E it was for your excitation, here it is again decreased. Then DUM B L was lacrimation, here it is a dryness of the eyes or your blurriness of the vision. Then there was a DUM B L S for sweating, here it is a decreased sweating. So if we study like this by correlating, it will be very easy to write us in the exam the appropriate point. Now let us study some of the MCQs. The first MCQ is, which is the vagolytic drug which comes in the anticholinergic classification? And the correct answer is atropine. Now the second MCQ, which is the drug which is used for the peptic ulcer treatment in the anticholinergic classification? And the correct answer is pyrazapine. Now the third MCQ, what is also called as snowflake disease, for which you have to mention the answer in the comment box. Now for the fourth MCQ, atropine which acts mainly on which of the gland? First one, your salivary gland, second adrenal gland, third your pineal gland, and fourth testis. For that also you have to answer in the comment box. Hope you like this MCQ, which I am increasing day by day, so that you can able to correlate all the questions and the answers, so that it will be easy for you to solve all the MCQs and all the short notes or the long questions in the exam. Thank you.